My name is Amy Hughley, and this is my PowerPoint presentation on Unit 4, Surgical Instruments by Function and Procedure. The procedure that I'm going to be talking about today is the tonsillectomy procedure. What is a tonsillectomy? This is a surgical procedure that is performed with or without an adenoidectomy that completely removes the tonsils, including capsule and the muscular wall. Basic anatomy involved. The palatine tonsils are a component of Weydier's ring of lymphoid tissues. Some other components include adenoids, tubal tonsils, and lingual tonsils. The first instrument I'm going to talk about is the Alice clamp. This is a surgical instrument with sharp teeth used to hold and grasp heavy tissue. It is also used to grasp fascia and soft tissue such as breast or bowel tissue. Alice clamps can cause damage, so they are often used in tissues about to be removed. The category is grasping and holding. Use the tonsils is grasped with the Alice clamps and medialized. How should the instrument be inspected? Check for any visible signs of damage such as cracks, bends, or rust. Ensure the clamps is clean and free from any debris or residue. Open and close the clamp several times to ensure smooth operation. The teeth should align properly and grip firmly without slipping. Confirm that the clamps have been properly sterilized. This typically involves autoclaving or using other approved sterilization methods. Ensure that the locking mechanism works correctly and holds the clamp in place when engaged. Before the procedure, the surgical technologist or nurse should lay out the instruments, including the Alice clamps, and perform a final check to ensure everything is in order. The next instrument is a Schnitt tonsil clamp. This helps doctors remove the tonsils when they cause infections and breathing problems. The category for this one is clamping and occluding. How is it used? Schnitt tonsil clamps are used to clamp the soft tissues of the tonsils to reduce the bleeding. How should the instrument be inspected? Inspection should begin at the distal tip with the ring separated. The jaw should be inspected for blood, and then the box lock should be inspected for blood and cracks. The ratchet should be tested by slowly locking the hemostats in each position. A second test is to lock the instruments on the first ratchet and gently clamp the rings on a flat work surface. If after 3 or 4 taps the ratchet holds, flip the instrument over and repeat the test. If the ratchet springs open during either test, the instrument should be sent out for repair. The instrument is the Metzenbaum scissors. Metzenbaum scissors are surgical scissors used for cutting and dissecting delicate tissue. The category for this is going to be cutting and dissecting. How is it used? Metzenbaum scissors are used to identify the vascular plane. How should the instrument be inspected? Check the blades for sharpness, making sure they can cut smoothly. Inspect the blades. Look for any corrosion, pitting, or discoloration on the blades. Check for cracks, chips, or malfunctioning blades. Evaluate the alignment, making sure the blades meet evenly, and make sure there are no gaps overlaps. Make sure when you open and close them, it moves effortlessly. Make sure the tension of the blades are just right, not too loose that they don't cut properly, and not too tight that they become hard to open and close. My next instrument is the Yanker suction tip. The Yanker suction tip is a medical tool used for suctioning secretions from the mouth and clearing operative sites during medical procedure. The category for this is going to be suctioning and irrigating. How is it used? This tool is used to suction oropharyngeal secretions to prevent aspiration. A Yonker can also be used to clear operative sites during surgical procedures and is suction volume counted as blood loss during surgery. How do you inspect this instrument? Always disassemble multi-part suction tubes, such as a Yonker suction, for cleaning and inspection. Select the appropriate cleaning brush style and size for the specific suction tube being cleaned. Brush diameter should be large enough for the bristle tips to contact the inner walls of the suction tube, but not so large that the brush may become lodged in the instrument or cause damage to the suction. Brush length should be long enough for the bristles to completely exit the tip of the lumen to allow the blood/soil to be removed from the entire length of the suction tube. Next, I added just a few pictures of where the tonsils are located, instrumental tonsils, and the inside of the mouth. And this is my reference page. And this concludes my PowerPoint presentation. Thank you.